The Dr. Fab Show, in association with Neostrata Skin Active.
Hi, I'm Stephen Hattisides and welcome to Dr. Fab. Coming up on today's show, insights into sexual regeneration, ways to help you simplify your beauty regimes, and innovative treatments to help remove those stubborn areas of fat. Today we're with our Fab Health experts, Dr. Prema, leading aesthetic surgeon, Dr. Sharif, pioneer of non-surgical aesthetic medicine, and Dr. Adele Sawa of the Harley Street Skin Clinic. This week, your essential skincare guide. But first, let's chat about sexual regeneration. So, Dr. Sharif, you're an expert in this field, so much so, you've been nicknamed Dr. O. So why is sexual regeneration such a hot topic at the moment?
I think there's a lot of factors contribute to this. First is the fact that there's a lot of non-surgical treatment has appeared to the market. Before there was only surgical treatment. I don't want to be, I'm trying to be fair, but a lot of them were not perfectly satisfactory for the women. And also the fact that she could tell her partner, I'm going to have an operation in my vagina. It wasn't really appealing to a lot of women, except if it's quite serious. But to enhance or for cosmetic appearance, for example, they wouldn't like to go through this route. For a lot of non-surgical treatment that appeared in the market, this become quite appealing for them. There's a lot of education that has been around to teach them that there's something there for them. And also with the stress that we're having in the society, there's a lot of divorce rate, high divorce rate. There's people go into the second and third relationship. So they want to feel that they are fresh again. So they go to these routes to enhance their sexuality.
Sure. I mean, Dr. Prema, you being a female doctor, I mean, do you see a big demand for this?
Absolutely, and when I was doing general practice, there was a high demand for this, but it's becoming more and more accepted to be able to talk about it now, whereas before it was quite a taboo subject. Only a few people came to their general practitioners to actually ask about it, but even in general practice at the time, there wasn't much available apart from surgical intervention.
And now is it becoming a lot more cosmetic? I mean, obviously from what you're saying as well, I mean, you talk about general practice, but obviously it's becoming a lot more cosmetic, is that right?
Absolutely.
I think this is, the aesthetic industry has led the non-surgical technique into this area as well. So with the appearance of all these treatments, women started to become more aware that this is something that could be done without surgery. And I think for them, this is becoming much more appealing.
Well, I think it's an exciting topic. Now I'm going to move over to you, Dr. Adele. Now we're going to be talking about skincare. People's beauty regimes have got so complicated today. And I mean, Dr. Adele, can you just tell us, maybe some suggestions or tips that, our viewers can obviously take in about, how do they find the right skincare for themselves?
Yeah, I think that's a great question that you asked, because there are an overwhelming number of products now on the market that are available to people over the counter. And the tricky thing is for patients is they often get confused, or they're using too much or too little product. I think it's very important for patients to understand the basic anatomy of the skin. It's a living organ, and the products that you apply to your skin, you really want to have cosmetic enhancement and scientifically proven ingredients. So at the Harley Street Skin Clinic, we promote skincare products which are active and have scientific evidence behind them. So what you really want to do is choose a cosmetic skincare product which penetrates the top layer of the skin, which is often dead, and thereby acting upon the dermis, which is the second layer. And that stimulates collagen and elastin production and will help with the fine lines, wrinkles and brown spots that people suffer from. So the medical systems that we advocate at our clinic are VI, Abaji and Jan Marini. However, they all have similar principles of exfoliation, which is basically unplugging the stratum corneum, which is the top layer of the skin. And we advocate patients to do that once or twice a week, depending on how oily their skin is. Using a good moisturizer is very important to hydrate the skin. And I think the most important factor is using sun protection, so SPF 50 to protect against UVA and UVB rays, because they really do cause premature aging.
Great. I mean, Dr. Prima, just to add on to that, I mean, you do a lot to do with skincare, don't you? So what would be your sort of top tip people can take home?
So I think it's all about being very realistic with everyone's time management in the morning. Sometimes there is just a long list of products that you're meant to be putting on your face, but you've really got to tailor make it for yourself, and something that's fast and achievable and realistic.
Great. Well, I think that's some great information for our viewers to take home, so thank you very much for that. Around 80% of 11 to 30-year-olds have suffered from acne. Now I'm with Ruman Sharma, our Dr. Fab expert, looking at remedies for acne. Now I have an email from viewer Jordan Adamson from Kent who writes, so I'm 18 and I've had bad acne on my face. It's making me shy and embarrassed to talk to girls. I'm also getting some scarring too. What's the best way of getting rid of it as I feel really depressed?
The first thing I would say, Stephen, is to reassure Jordan. We all get acne, especially teenage acne. I understand it can be quite personal, but there's really no point in getting depressed about it. One of the other main things I get in my practice is people wanting treatments, fast, effective treatments, but it's really about managing those expectations. I would recommend a 3-step process, which is cleansing, the treatment itself, followed by a sensible moisturiser.
Okay, so if you can pick up step 1, if that's the cleanser, is it?
Yeah, so this is the cleanser. It's important that you cleanse the face because that will remove all the bacteria, the dead cells and all the grease.
So step 1 essential, so yeah, step 2, so there's 2 products there.
Yeah, there's 2 products there. This one is called Panoxyl. It's actually got antibacterial properties. So it's very much needed to remove any bacteria from your skin. It's also an aquagel, which means that there's no oil formulation in there, so it's very much oil-free.
And so the other product, does that complement this, does it?
The other product is slightly weaker ingredient, but it's here as an alternative. It's new, we're getting a lot of people wanting to use this product, but the only difference between this one is a cream, whereas the Panoxyl is a gel.
So then, I like this. It's quite simple. 3 steps?
3 steps, very important at each stage. The final step is moisturising.
Okay,
and
let's have a look at that.
It'd be interesting to know if Jordan actually uses a moisturiser, because I know guys sometimes miss this key step. There's also a misconception that if you use moisturiser, you tend to be putting oils back into your skin. That's not the case. If you select the right one, which is this one, this is an oil-free moisturiser.
Okay, so all of the products really go well together, so if they did use a more standard moisturiser, would they get the same results, or is it needs to be these three products?
Well, there's lots of alternatives out there, but my key advice would be to use an oil-free moisturiser or product where possible. Every skin cell needs its own natural hydration, so it's important to put the moisture back in. Also, if you leave the skin to dry out, the flakes that are left on your skin can cause a lot of plugging. And what that then does is it's detrimental to getting good acne care.
And these products are just for teens, or is it for adults?
Well, acne can actually go into adulthood as well, so that's not uncommon.
Okay, so these products are suitable for any age?
Yeah, teens and adults.
Okay.
I've selected these basically because of the budget size.
So what happens if Jordan has cleansed, he's done all the moisturising, but he's still not getting the right results?
Yep, again, another key question that I always get asked. And what I will say is it's about managing those expectations, just being a little bit patient, because with acne, it can take weeks, months even. We're not talking days here.
That's really, really, really good advice. That's fantastic. Thank you so much. That's really interesting. Going to dinner from the office can be tricky if your hair is not up to an evening out. Our celebrity hairdresser Snowden shows us a new twist to a classical hairstyle that is soft, feminine, and just a few bobby pins away.
If you're at the office and you're having to go out for dinner, a last-minute invitation, I've got a great hairstyle just for you. So you're going to bring the hair around to the side. You're going to pin it very low at the nape. just behind the ear. You're going to do the same. So you've gripped the hair all over together on one side behind the ear. You're going to take a comb, lightly back comb it to create some volume and texture. You're going to put some light hairspray in. You're going to lift it up. You're just going to gently roll it into the side, like a really sort of loose bun, and then you're just going to grip that there. So it's a very simple, very easy, elegant office to evening look. It's very chic and simple to do.
Not really, not so much now. Before my holidays, yes, when I was starting to like cut down carbs, that sort of stuff.
I just eat whatever I want to eat. I don't really care.
If I fancy something, I'll have it. I just try to keep my weight down.
No, just have what I want.
Just little and often of all kinds of food. You can't cut anything out, I don't think, because you'll just become intolerant to it.
You know what you should eat and you know what you shouldn't.
I try to eat regularly, at regular intervals, but I do have a sweet tooth and I am prone to cake and biscuits and things, but again in moderation.
That's all from part 1. Join us again after the break.
The Dr. Fab Show, in association with Neostrata Skin Active.